Hi, my name is Heather Ramos, and today I'm going to be performing the subcutaneous injection skills video. I'm in my school uniform and I have my school badge. I have no artificial nails or nail polish. I'm going to do a quick room scan so you can see my environment. Today I have with me Miss Smith, the box that my laptop is sitting on, and then the skills supplies to the right of me. I'm going to plug my laptop back in. Today, the physician has ordered 1,000 units of heparin for Ms. Smith to be delivered subcutaneous times 1 dose. So I'm going to verify the physician's orders in the EHR or the MAR, and I'm going to verify using the 6 rights of medication administration, which is right patient, right medication, right dose, right route, right time, and right documentation. I'm going to confirm the amount of medication I'm going to give to patient. So I'm in the supply room right now, the med supply room, and I have found heparin, and it's supplied 10,000 units per 10 mLs. The physician has ordered 1,000 units, so I would be doing my dosage calculations and drawing 1 ml of medication for this patient. I'm going to check the integrity of the vial and check for the expiration date. My supplies include the medication, the 3 ml syringe. It could either be a 1 ml or a 3 ml. I have a 3 ml syringe. I have a 25 gauge 1-inch needle. I don't have a 25 gauge a 3/8 inch or 5/8 inch needle. So I'm going to just be using what I have. I have a gauze pad, alcohol prep pads, and then my gloves. So I'm going to check and verify the physician's orders, gather my supplies. I'm going to enter patient's room, close door or curtain for patient privacy, and perform hand hygiene. Hi, my name is Heather, and I'm going to be your nurse today. Can you please tell me your first and last name and your date of birth? And then verify 2 patient identifiers using the patient's wristband. All right. Thank you, Ms. Smith. Can you please tell me if you have any medication, food, or environmental allergies? No, you don't. So then I'm going to check patient's chart to confirm that they don't have any allergies as previously stated. I'm going to be reviewing and verifying the physician's orders. And then I'm also going to check that there's no contraindications for this medication for this patient. All right, so today your physician has ordered heparin. It is a type of blood thinner that's used for a variety of medical conditions to help prevent clots. The way that it works is it helps boost your protein in your body called antithrombin 3, and it helps prevent clots from forming or getting bigger. There are some side effects with this medication, which would be pain around the injection site or bruising easily. I need you to report any signs of these adverse effects, which would include severe bleeding from your gums, from under your skin, and either in your urine or your stool. If you develop a rash or a shortness of breath, please let me know if you experience any of those immediately by pressing your call light. Now, when I deliver this medication, you may experience a burning or a stinging sensation. That's not from the medication, that's just from the injection. So before we begin, do you have any questions for me? No, you don't? Okay, so let's go ahead and get started. I'm going to perform hand hygiene and then I'm going to put on some clean gloves. I'm going to verify my medication. I have heparin. I'm going to clean the top of the vial using an alcohol prep pad, including the rubber top. I have my appropriate size syringe. And then I'm going to draw up 1 ml of air, which is equivalent to the 1 ml that I'm going to be drawing up from the heparin vial. I'm going to carefully remove the lid or the cap of the needle and then inject the needle and the air into the vial, invert, and then draw the 1 ml of medication. Let's go ahead and flick out the bubbles. Okay. I have 1 ml of medication. 1. I'm going to use the single scoop method to recap my needle. If I was to be drawing up this medication away from patient's bedside, I would label this syringe with the patient's name and the dose. I'm going to set this aside. Now I'm going to assess the site that I'm going to be using. So for subcutaneous injections, you can either use the outer aspect of the outer arm. You could use the abdomen from below the costal margin to the iliac crest, or you can use the anterior aspect of the thigh. I'm going to be using the abdominal site, 5 centimeters, either from the left or the right umbilicus. If that site is not available to use, then I would be using the anterior aspect of the thigh. I'm going to assess the skin for any bruising, inflammation, or edema, skin discoloration. I'm going to feel for any tenderness or masses. I'm going to grasp the skin with my thumb and forefinger and measure the skin fold from the top to the bottom and make sure that the length of the needle is half of the length of this skin fold here. Now I'm going to clean the area. I'm going to get an alcohol prep pad and I'm going to place it directly in the center of my chosen site. And in an outward circular motion, roughly 5 centimeters or 2 inches, I'm going to clean the area. I'm going to allow that to dry completely. I'm not going to wave my hand or blow on it. Now, once I'm ready to administer the medication, I'm going to pick up the syringe in my dominant hand with my thumb and my forefinger. With my thumb and forefinger of my non-dominant hand, I'm going to grasp the skin and pinch. Because I'm using and administering heparin, I will be pinching the entire time. If I was not administering medication, heparin medication, then I wouldn't be pinching the entire time. So I'm going to remove the cap, and at a 45 to 90 degree angle, I'm going to firmly insert the needle. I'm going to, with my non-dominant hand, grasp the lower end of the barrel, keeping it stable, and with my dominant hand, inject the medication slowly over a period of 30 seconds into the patient. Okay, withdraw the needle and discard in the sharps container. I'm going to place a gauze pad over the injection site. I'm not going to press or massage on the area. There might be some bleeding. It is a blood thinner. I'm going to remove my gloves. And I'm going to perform hand hygiene. Now I'm going to document that I just administered this medication to the patient.